Having a fibroid consultation is actually a very, very low stress and a very straightforward process. When we see a woman at our office at the Fibroid Treatment Center, we simply discuss her symptoms and we go through the whole range of treatment options available to her. Because we're not a woman's primary gynecologist, we don't have to do a pelvic exam or any other invasive exams. We simply talk and learn about what your symptoms are and what's bothering you. Once we discuss your symptoms, we can go through all of the treatment options. We want to make sure at your consultation that you're educated to every single possible option that you could have for your fibroid disease. We don't want to talk you into or out of different treatments. We simply want to educate you and get you involved with the decision-making process. Consultations at the Fibroid Treatment Center last as long as they need to. We want to make sure that you have all the time available to ask questions and get detailed answers from myself. You don't have to bring anything with you to your consultation. If you've already had an ultrasound or an MRI, we would encourage you to bring those reports so that we can discuss them. If you haven't had any ultrasounds or MRIs yet, it's okay. You can still come in for a consultation, and we can order any tests that might be needed after the consultation.
The consultation was great. I felt that he sat down, he looked at me in the eye, he seemed like completely focused on the appointment. My husband came to me during that consultation, and he gave me the whole gamut of options, from doing nothing, because remember, I had no symptoms, so it's not like I had all this excessive bleeding or pain that a lot of women experience. I had no symptoms other than they were there and they were growing and they were perhaps pushing on some other organs, but I didn't really have an immediate need for a fix because I didn't really have a lot of symptoms, especially pain. I had no pain. So one of his options was, you don't have to do anything at this point, but if they keep growing, you're gonna have to make a decision. And then he went through several options up until a hysterectomy.
In my consultation, Dr. Harris was really patient. He answered all of my questions. I didn't feel rushed at all, and Dr. Harris was really positive about being able to help me, and that just made me feel comfortable with him and comfortable with him performing my embolization procedure.
Yeah, he was great. I brought my husband in, and my husband's brother is actually an interventional radiologist in New York. And Dr. Harris took the time to call him, which was so great, and discuss my situation with him. And they both kind of agreed that that was the right thing to do, and it was wonderful. Yeah, in fact, we decided to schedule the surgery that day.